Foveal sign and ulnocarpal stress test. There are no relevant disclosures. Ulnar side of wrist pain is common but can be quite challenging to diagnose, as there are multiple pathologies with a broad differential diagnosis. The foveal sign, or tenderness elicited along palpation of the fovea, is suggestive of TFCC pathology. The ulnocarpal stress test was initially described by Nakamura, and if positive is indicative for ulnocarpal abutment, where the ulnar head abuts against the lunator triquetrum. This test is also quite sensitive and can be positive in TFCC pathology as well. The TFCC is a complex of soft tissues that helps to stabilize the ulnar side of the wrist as well as provide load transmission across the ulnocarpal joint. It is comprised of multiple structures, including the articular disc, the meniscus monologue, as well as the dorsal and volar radiocarpal ligaments and the ECU subsheath. We can see here, as demonstrated on our anatomy glove, the radial ulnar ligaments in blue as well as the ECU subsheath in green. And so now we begin by palpating the fovea. So by just palpating down the ulnar side of the patient's hand, I palpate the base of the fifth metacarpal as well as the hamate, and then subsequently the next valley is the fovea, which we are identifying here. So again, the fifth metacarpal, the carpal metacarpal joint there, followed by the hamate, and then the fovea below this. And this test is positive if there is tenderness on palpation of this region. Moving on to the compression test, we essentially get the patient to keep their elbow flexed and keep the wrist in neutral position, and then with some loaded ulnar deviation we pronate and supinate the wrist, and this test is positive if there is pain elicited. So again, there's the fovea there, and ulnar deviation as well as loaded pronation and supination leading to pain.